Welcome to another educational video from LotusMedics. I'm Dr. Sachin Kotasthane, and today we're going to talk about the Mirena intrauterine system. You may have already heard about a hormone device called the Mirena, which is prevalent and available both as a contraception as well as for control of heavy bleeding. The Mirena acts for about 6 years in preventing pregnancy when correctly inserted and located, and it also reduces the menstrual flow, making it ideal for women who have heavy periods. It's about 99% effective. It's inert, it's flexible, and it can be easily removed by any healthcare professional, including your GP. It is reversible, so once it is removed, there's no delay in return to fertility. A Mirena is very small. It's little over an inch in length, shaped like a T, and no bigger than 2 stacked dice on each other. It can be inserted even if you may not have had children. We can have it inserted both as an outpatient or an inpatient. When we have it inserted, your doctor will complete a consent form and also give you some information on the Mirena. A leaflet on the Mirena is also available on the LotusMedics website. Please refer to that. Your doctor will offer you a choice between an outpatient insertion and an inpatient insertion of the Mirena. An inpatient insertion is usually done as a day case procedure under a short general anesthetic. During an inpatient insertion, the cervix often requires dilatation. This is significant as there are a number of women, especially after menopause, or who may have had treatment to their cervix, or who may not have had a vaginal delivery, in whom the cervix is stenosed or completely tightly shut. In these cases, an outpatient insertion may not be feasible, and it's desirable to perform an inpatient insertion of a Mirena under a short general anesthetic. A few considerations, including some side effects and risks of Mirena insertion. First thing is pain. Some people might have insertion related pain, especially if they're having a Mirena inserted as an outpatient. In most cases, this is usually a mild discomfort. And of course, if you're having a Mirena inserted under an inpatient, you will not have any insertion related pain because this is done under a short anesthetic. After the Mirena insertion, in either case, there might be some cramping and mild discomfort. This usually responds well to paracetamol or Kotasthane. Bleeding. If you're on your period, don't worry. Come for your Mirena insertion, as actually the cervix might be slightly more open on your periods and might in certain instances make Mirena insertion a little easier. You might have a little spotting or light bleeding after a Mirena insertion. Expect that in a few weeks after a Mirena insertion, or sometimes even a few months, you might have something called irregular shedding. This is not actually a huge problem if you're told about it and if you know about it. What is irregular shedding? Irregular shedding is abnormal light spotting, which is due to the hormone in the Mirena going in and converting a little part of the lining and shedding it out of the uterine wall. And this usually gets better in a few months, so that in 50% of women, you will not have a period after the Mirena is inserted, or you will have very light spotting and very light periods. Let's talk about infection. The risk of infection with a Mirena insertion is very, very low. But if you have a pre-existing pelvic infection, you may need antibiotics. And in this case, a Mirena which is already in place may need to be removed either by hysteroscopy or laparoscopy. There's a small chance that the uterus might expel the Mirena. This usually occurs in the first few weeks of a Mirena being inserted. If this happens, don't be alarmed. Use an alternative contraception and please call your doctor immediately. There's also a small chance that the Mirena might perforate through the uterus. This is even rarer. If this happens, you may have some discomfort, and obviously the Mirena will not be working to its maximum potential. Inform your nearest health professional, and this Mirena may need to be removed as well. Pregnancy. A pregnancy is extremely rare with the Mirena. As explained before, the Mirena is extremely effective, and it's about 99.8% effective in preventing a pregnancy. But if a pregnancy does occur with the Mirena, it is more likely to be an ectopic pregnancy, which is a pregnancy inside the tube. So if you feel you have any unscheduled bleeding or any sharp pains, please perform a pregnancy test and contact your nearest doctor immediately. After the insertion of a Mirena, especially as an outpatient, we will perform an ultrasound scan to confirm the integrity of the cavity and to confirm that the Mirena is in the right position. You will also be given a card which basically tells you the date for your Mirena removal or replacement. Let's look at removal or replacement of the Mirena. A Mirena can be easily removed by any health professional, also your GP, local GP, who can easily remove it when it's due for removal, or if you want to get pregnant. Removal is usually easy, and if the threads are easily visible, it can just be taken out in a matter of a minute. A pelvic ultrasound is usually performed as an outpatient to confirm that the Mirena is in the right position. Your doctor will also give you a card which tells you the date of your next Mirena replacement, or the date that your Mirena needs to come out. If you want your Mirena to be removed earlier, that is if you want to get pregnant, or if it has completed its duration of 5 years, you can go to your nearest health professional, either your GP or to a gynecologist, and have the Mirena removed. Removal of the Mirena is usually a quick process, especially if the threads are visible. If the threads are not visible, or if the Mirena is impacted, removal may need to be done as an inpatient procedure with a hysteroscopy. These are some of the contraindications for women who can't have the Mirena. If you've had any unscheduled or abnormal bleeding that has not been investigated, if you are having any current pelvic infection, if your cavity is abnormal, or you've had fibroids within the cavity or an abnormal uterine shape, if you've had a breast cancer, or if you have abnormal liver functions, a Mirena may not be the best option for you. These are some of the contraindications to having a Mirena. If you've had any unscheduled or abnormal bleeding which has not been investigated, if you've had any current pelvic infections, if you've had a history of breast cancer, if you've had abnormal uterine shape or fibroids in the uterus, or if you have had any liver disease like Wilson's disease or any other significant liver issues, then the Mirena might not be the best option for you. Please consult your doctor to look for any alternative options. I hope this has given you some information about having a Mirena inserted and its suitability towards your own contraceptive requirements, as well as treatment for heavy bleeding. Please read the leaflet on the Mirena on the LotusMedics website, and we at LotusMedics are always here to help you understand your contraceptive needs better. Thank you.